Thank you so much for joining us. After our hour-long special opioid crisis, what you need to know, we decided to take this conversation a little bit further than what we just did in this hour-long special. And we are holding this Facebook Live for you to join us and to ask any questions of our specialists joining us today. We have Dr. Tim Pelkowski, primary care doctor. Thank you for joining us. And Jeanette Redenius. Did I say that right? Okay, which we saw you in the program as well. You are the program director at the Erie County Drug and Alcohol Abuse. So thank you so much for joining us tonight. Why is a discussion like this so important in our community and really everywhere these days?
You know, and for me to start, it's to save lives, right? We know that this epidemic is only increasing, getting back to where it was after the COVID pandemic. So anything we can do, even just to save one life, is going to be well worth it.
As a doctor, are you seeing an increase then, or just more awareness about this problem?
I think probably both. I do think there was a little bit of a lull, and it's probably naive of me to say that. I think it was just overshadowed by COVID, and I think we're really getting back to where we were almost before that. So that's probably the big change that I've seen.
And we talked a lot in the special too about there is a need for opioids, and I'm sure as a doctor you see that. Is it hard to navigate, or?
There's certainly challenges. It can be an appropriate treatment when there's an appropriate assessment, an appropriate reason for it, appropriate monitoring. Absolutely, can definitely produce very good success. But there's a lot of boxes that need to be checked to make sure that it's going to be safe for that individual.
And Jeanette, when it comes to treatment in the county, we had talked and you said there was an increase, but there's other concerns as well. Talk about what you're seeing in terms of problems in Erie County.
One of the biggest concerns is that substances are being cut into other substances. So somebody might think that they're taking cocaine and they are unaware that there's fentanyl in it. And so they will inadvertently become addicted to things like fentanyl, and obviously the potential for overdose is much higher. And at the Erie County Office of Drug and Alcohol Abuse, we have recently received fentanyl testing strips, which would allow people to test their drugs before using them, which is a harm reduction technique.
And do you think, though, I mean, when you hear about these overdoses with fentanyl, and we heard in the special too, using one time with fentanyl, it's not something where someone has to be an addict to die from it?
Absolutely. Unfortunately, anybody dies from it. But
what would you say too? I know the important thing too is for parents who are afraid of their children falling victim to this, or they have a child who they see is struggling. What advice would you give to that parent?
From our standpoint, I think it's really having candid conversations about this. It's going to be very important not to ignore this. And I think the other thing is to try to avoid the stigma that can occur around this and make sure that we're accessing resources like the Erie County Drug and Alcohol Association in particular.
And we do want to encourage people too, if you're joining us on Facebook Live, this is your opportunity to ask questions with our special guests who are experts in this area. And again, don't be afraid, because we talked too about the stigma. And this is something where you can't worry about the stigma. And sadly, it's out there, but I think the more we talk about it, hopefully people don't feel alone, because making that first step for help could save a life.
yes, and there are so many people living in recovery, and that's something that we do really need to make an effort to celebrate and highlight, that people do move beyond addiction. There is hope. And that's important too.
Now we do have a question coming in, someone asking, why are some people more prone to the addiction, the fentanyl addiction, than others?
And from my understanding, it's biology, genetics. Some individuals, their brains are wired a little bit differently, if you will. It can be more devastating to have that exposure, and even hearing one exposure can be too much and create an addiction in that regard. I'd still say there's a lot more that we don't know around that, but yes, absolutely those kinds of scenarios can occur.
And so if someone, you know, in terms of a family maybe where alcoholism or where something, is it similar to that?
Absolutely, and I know when we're trying to treat for a patient, we'll go through the family history. If we're seeing there's multiple family members with different addictions, even tobacco addiction, that could put them in a different risk category when all is said and done.
And I know we've said repeatedly too, and I think we need to say it again, if you have a problem, if you have diabetes, you take medicine. If you have allergies, you take a medicine. There's no shame in getting help for something like this as well.
Absolutely, I would echo that. And I know that's one of the things we'll try to remind patients, just that there can be success around this, and that it's important to have these conversations. I think people really feel in a silo around this. They're very embarrassed potentially around this, and don't realize how many other individuals are going through this. And we try to review that with them.
And we have throughout the evening put up the phone number too for the Erie County Drug and Alcohol Abuse. What can someone do if they're watching this and they need help?
They can call our office immediately. We have somebody who is available 24/7. We would do a screening and then schedule them to come in for an assessment where they would be assessed to determine what level of care would be best for them.
And I know, each program is different, and I know you don't necessarily take people in, correct?
Correct.
But you do put them toward the right program. What are some of the programs out there that maybe you refer people to?
The lowest level of care would be outpatient, so it can range all the way from outpatient to inpatient, and then the gamut in between. So there's residential, there's partial, so it's a wide variety.
How hard is it to beat this addiction?
It's a challenge, there's no doubt about it, and there can be missteps along the way. I think it's still trying to be there for individuals, encourage them to get through these humps when they occur, but it's a lifelong challenge, there's no doubt about it. But there can be success, there can be light at the end of that tunnel.
Do you see a lot of success stories?
There are a lot of success stories, and they're beautiful and amazing. It just reminds me of the human spirit. One of the more recent trends that is sort of getting in the way of recovery is the polysubstance use, which we are seeing an increase in that. So people who are intentionally, say, taking methamphetamine and fentanyl together, and that makes treatment a little bit more complicated.
And I know too, we had talked off camera before about other problems. And I know the gentleman with the DEA had also brought up, you were talking about in Philadelphia, what was the name of that? It's not the zombie.
Xylazine.
Xylazine.
Yeah.
Are we starting to see that in Erie County? Because I know a lot of people are familiar with those videos, sadly, out of Philadelphia.
We are starting to see that. Right now, thankfully, it's minimal, but as my boss would say, if you look at a map of how it's spreading from Philadelphia, it's very much like a spread of a disease as far as the way it's moving. So, and I'll check news stories every once in a while, and it is like counties
Slowly.
closer and closer to us are starting to experience higher and higher rates of it.
And again, we want to encourage everyone, if you are joining us here today or tonight on Facebook, this is your opportunity to ask for these questions, especially, if you know someone, if you are that person, if you're afraid about a family member, where to turn. So even as a family primary care doctor, if someone has a concern, they can come to you, because it seems like everyone is equipped these days to point someone in the right direction, because it is such an epidemic.
Yeah, absolutely, and I know that's utilizing the resources in the community are certainly going to be one of the first things that we'll do. I think the other aspect is, again, trying to make sure that we provide care for all of their issues, if you will, not just the substance use disorder, but everything else. We're trying to do that under one roof, if you will, just because patients often will have that relationship with their primary care physician. It seems like a natural stepping stone, if you will, to other treatments.
Well, and we did just get another question on Facebook, someone asking, how do you approach someone? How do you talk to someone who you think is struggling? Either one, if you want to touch on.
Again, I think you have to be willing to have a vulnerable and likely difficult conversation, but there is reason to be concerned because of the overdoses, and so approaching that person from a point of concern and love, like, I'm really worried, this is what I'm hearing, I'm worried that you might be experiencing this.
And don't give up, because one conversation isn't enough probably in most of these cases.
Absolutely.
And don't be afraid, don't be embarrassed.
Exactly.
What are some of the signs? Are there signs that people can look out for?
From our standpoint, I think when I'm thinking of family, looking at others, these erratic behaviors, sedation type scenarios, or being so sleepy, if you will. I think what makes this so challenging is it's not very obvious, if you will. So it's very, almost in a roundabout way that suspicion comes about.
What are some of the different forms of treatment? Like, what's out there for someone? Because obviously it's not cold turkey, I'm guessing.
Yeah. From our standpoint, I know in our setting, we have individuals that are doing more medication-assisted treatment. So Suboxone or buprenorphine would be one aspect, if you will.
And that's managed.
Correct,
Okay.
yes. A medication to try to help manage this addiction, if you will. And certainly can see great success with that. And there's no doubt about it. And even just thinking about Jeanette's earlier comments, sometimes these individuals who've overcome this, even if it is requiring MAT or medications, just wonderful success stories to see them reintroduced back for their families, back in the work environment. Even it's very impressive to see these success stories.
Well, we just got another question too on Facebook that's timely, because someone's asking, what's the high or the likelihood of a relapse? How often do you relapse, and what's the success rate in terms of that? I guess not a success of a relapse, but how often do people relapse?
I was going to say, I think that in the field we kind of understand that relapse is part of the recovery journey, so it's not atypical. That doesn't mean, though, to give up hope. That just means that it's part of the journey, and like any journey, the path can be winding, but you get off the path, you just go back on.
It has to be extremely difficult, because I would imagine with opioids, it's, like we said, fatal in a lot of cases. It's not like, drinking or even smoking or something like we were talking about. So I guess there is a certain amount of, people wanting to get them help because they're afraid if they don't do the help now, next week they could be dead. But like you said, don't give up. You can't not try.
Absolutely. That's an important theme.
And you can give them supplies, things like, if you are concerned, fentanyl testing strips.
Or is Narcan
yeah,
helped?
Make sure they have Narcan on hand. So that way, should there be an overdose and there's somebody with them, they can administer the Narcan. So
certainly something we'll try to prescribe routinely, even if we have a reason for someone to be on opioids. There's risk still with that, even if it's an appropriate reason. Making sure that they have access to that in case something occurs is still going to be an important part of the process.
I just had another question too about, and I guess Jeanette, you can maybe work on this, or maybe too, Dr. Plakowski. How is the county working together? Is there a collaborative effort in terms of medical facilities and the county efforts to combat this?
there are a lot of different groups working on this together. I know that recently the Office of Drug and Alcohol Abuse have partnered with the Office of Children and Youth, because unfortunately we were seeing an increase in babies overdosing. So making sure that OCY has supplies, medication lock boxes, Narcan on hand that they can then provide the families that they're working with. I know the District Attorney's Office just partnered with Attorney General's Office for something called Law Enforcement Treatment Initiative. It's LETI for short, and that is where the police, district justices, District Attorney's Office can decide that rather they can kind of hold the charges in abeyance if the person decides to seek treatment, and then if they are successful at certain points in treatments, then the charges will be dropped. So there are many initiatives.
And clearly, I mean, you know, like we said, we dedicated an hour to this, and now the time here on Facebook to this topic. It's obviously important, and it seems like this is one of those things where everyone has come together. And we do have someone asking now too, where can they get Narcan?
They can call our office.
And certainly their primary care physician. Quite frankly, there's some state laws that you don't even require a prescription. You should be able to get it at a pharmacy. There can always be cost issues, but I know they're really trying to attempt to minimize that out-of-pocket cost, if you will. But yes, it should be very easily available, and even just a phone call over to the Erie County Drug and Alcohol Abuse Center.
Are you optimistic? I mean, it seems like daunting, the amount of issues surrounding this crisis.
I feel more optimistic than, say, 2 decades ago. You know, there just weren't as many options. Even just having buprenorphine, having naloxone present, having so many community resources. That team philosophy, team approach, right? It's certainly not just one organization or one physician. You know, even with our system, it's with social workers, it's with behavioral health, it's with the physicians, family members, networking with community resources. Really, all of that is so important. Even the DEA is an important part of this process and is a good resource for us to have in our community.
We're getting a question. How does the Good Samaritan law apply in Erie? Is the question.
And my impression of that, I can do a first stab at that, is, if you are around someone who's having an overdose, you're able to call for assistance, you're able to stay there, and you're not going to be punished under those circumstances because you're trying in good faith to help someone, is really my impression of that.
And it also applies to administering Narcan. So that if you administer Narcan, which is not harmful in and of itself. So if somebody you thought maybe they had an overdose and you administered Narcan and it actually ended up not being an overdose, the Narcan is not going to harm them. But I think people are concerned about administering it, and so the Good Samaritan law would protect them from any lawsuits.
Okay, so don't be afraid if you're in that situation again.
Absolutely.
You better be safe than sorry.
Yes.
In terms too of, and you were saying too, from 2 decades ago to now, the fact too that we're talking about it, we can't reiterate that enough. It's just the fact that people know about it. We have to get rid of that stigma if that's possible, and don't be afraid to ask for help or to try and help someone if you're concerned about
Yeah,
them.
can't underscore that enough. Absolutely. There's definitely options, and more robust options than in the past.
And so if someone called, and Jeanette with you, and I know we've talked about this a lot, but say as a mom, if you're afraid of your child is having issues, can they call you? Are there things parents or friends can do?
They can certainly call us. There are a lot of groups in the area that support families and friends of people suffering with substance use disorder. Parents can call us. Now, in Pennsylvania, there is no age of consent for a assessment, so the child would have to want to come in and do an assessment.
But in terms, and that was kind of where I was getting, is like we saw in the special too, is that they've got to want help, which is hard to do when you're dealing with an addict, and they've got to hit that rock bottom, which sadly with this can be death in a lot of cases with opioids. But there are places that someone can go if they want to try to start the process and learn how to maybe approach, because like someone had asked earlier, how do you talk to someone? Because you do have to approach it correctly, because if you do it wrong, it's probably not going to work.
And that's why the harm reduction strategies are so important, because somebody might not be ready now, so we need to keep them safe until they are ready.
So you had talked about the fentanyl strips and all of that. Where can people get those?
They can get those at our office, and again, they just need to call. They're free. Same with Narcan. We will be getting xylazine testing strips.
Oh.
I believe starting in the new year.
And where are you located?
240 West 11th Street.
Okay. So people can, and the phone number too again?
It is
I was going to say I should know this, but.
814-451-6877.
And no questions asked.
No.
Like you can go in, get what you need, no questions asked. And the same too, if someone comes to you with a concern, you're not going to rat them out.
Non-judgmental is really the key scenario. This affects so many individuals. It's important to keep that in mind. And I can't help but echo even just the availability of these test strips. I cannot possibly relate how often we're caring for a patient who may think they're only using marijuana, but on further investigation, we find out that there's fentanyl, and they just were never aware that they were being exposed to it on a routine basis. This is a very, very common scenario from the fentanyl alone, and I know we're going to be seeing other substances as well.
Someone is asking how accurate are these fentanyl testing strips?
My impression is they're very accurate. There's never anything 100% accurate, but very good. You can definitely trust these results.
I mean, and it could save your life.
Absolutely.
Because those are the tragic stories we hear. You know, people, like you said, just thinking they're smoking some pot.
Right. And the danger with fentanyl, a minuscule amount.
Very small. Well, we saw that at the
daycare.
Just a little bit of trace can take a life.
Absolutely.
What are some thoughts, too, in terms of tonight? Why can't people just stop using? Like, I'm sure people are like, come on, why can't you just stop? Just stop taking it.
Yeah, that addiction scenario, again, just the difference in biology. For some individuals, that's much harder to do. And for instance, some may be responsive to buprenorphine. I know we made the comment earlier about if you're a diabetic, we don't stop your insulin after a few years and say you're cured. We continue that. Quite frankly, that's the same analogy with MAT or medication-assisted treatment. If they need methadone, if they need buprenorphine, potentially even lifelong or many years, that can be a life-saving treatment, and we don't want to withdraw that after 6 months or even 6 years. It could be important to continue that for as long as it's necessary.
Because they're like, hey, I'm feeling better, I can beat this, and then they stop taking it, and then they
Yes.
wind up right back where they
Yes.
are. Can we let's talk a little bit about the long-term consequences, because a lot of these things we're talking about too, kids are starting at earlier and earlier ages. What are some of the long-term consequences on an adolescent?
And to feel that, the human brain is still developing until the age of 24 or 26. So to have an adolescent utilizing these or abusing these substances can definitely produce long-term results. And I'd say they're still researching this, still trying to find out, and they're still seeing so much associated with this. So yes, even someone who's 18 is still growing, still in that developmental stage from their brain standpoint. Being exposed to this can have dire consequences.
You said infants, obviously, because of maternal. How young are some of the people you're seeing? I mean, who aren't obviously getting it through their
The cases that I was thinking of, the babies were not mobile yet.
Okay.
And yes, we have specific protocols in the hospital for newborns born to a mother who has an addiction issue, a heightened awareness that they may be going through withdrawal, and then getting these infants through that. A lot of protocols in all the hospitals on how to deal with that, involving the NICU if necessary as well, of course.
Someone is asking, and we kind of touched on it earlier, but what are some of the signs that parents or teachers or friends can look for?
I think it's still very vague, which makes it so challenging. Erratic behavior, I hate to say it, is probably our biggest scenario around that. But yes, I think that's what makes it hard. There's not going to be a nice, good laundry list of 100% accurate issues. It's often that is our biggest issue.
I would say kind of echoing that, the best way I would think about it, because there are so many substances and each one of them would have a different set of symptoms. So what I would say the best thing to look out for would be a significant change in what was normal for that adolescent.
And it could be, maybe it's something less than an opioid, but usually any type of addiction or substance abuse is going to read that way. So just make sure if you see a personality change. Someone is asking also, is Narcan available in schools? Do we know locally?
I'm not aware of any specific school program around that, at least in our community.
I think that would vary school district by school district. It's certainly available to them should they want to have it.
So it'd be up to,
Yeah, district by district, school by school.
Could you provide some advice for young people who may already be struggling with substance abuse and addiction who want to seek help?
And I think it's going to be having that conversation. These are tough conversations, whether it's with family, physician, even friends. It's important to bring up and try to get beyond that stigma issue and try to seek that help. I know it's not always easy, but there's so many resources out there. We've got to try to take advantage of it.
How old can anyone of any age call your office? Like, you don't have to be 18.
No, you do not.
Okay, so anyone any age can call if they feel like they need help, but they don't want their parents to know. Do they then have to tell their parents at some point?
They don't. No,
how does that work?
There is. I know, it's very interesting. There is not an age of consent in Pennsylvania. So for mental health, there's an age that an adolescent consent. That's not the case for substance use.
Okay. So anyone of any age, if you're struggling and you don't want to talk to your family, you can give them a call and they will put you in the right direction. Are there different programs then for adolescents versus adults?
Yes.
What are some of those differences?
It would just be, I shouldn't say different services altogether. They're the
approach.
same services,
Right.
but they would be geared towards adolescents.
Okay. So what could someone expect, though, if they did call and they wanted to start the process? What would be generally the first step?
The first step that we would do a screening, and what we're really looking for, there are any emergent needs. So does the person have a medical condition? Does the person need to go to detox? Because there are certain substances that withdrawing from them can be very medically dangerous. So we want to do a quick screening to make sure and rule out all of those things. And if those are ruled out, and it does seem that the person needs to come in for an assessment, then we would get them scheduled to come in for an assessment.
Now, someone's asking, and I mean, I know it's difficult enough when you're married to someone who has an alcohol addiction or, you know, any type of addiction, but when it comes to the opioid addiction, it's a whole nother ballgame. What kind of impact does this addiction have on relationships?
I think it can be challenging with those, and I would say all of them are equally hard in that regard. Alcohol, opioids, and these can tear families apart. And I think it can be challenging if the family's seeking help, which is good, and we want that. But if the patient, if that individual's not in a place where they're ready, I think again that's where this tension can come from a family standpoint. And it's tragic to see those scenarios.
And you see a parent struggling or a spouse who you simply want to help, but you know that that person's not ready. But again, we go back to don't give up. Yeah. You can't just try once.
And I think an important thing to remember is this isn't someone's failure. It's not some person's fault. Mm-hmm. This is a disease process mm-hmm. when all is said and done, and that's what's causing all of this.
It's your first step towards hopefully success. Sure. And just keep trying to get up that first step
Absolutely.
Somehow. Someone's asking too, what is the shelf life for Narcan?
And you'd have to check the package because that could vary based on the date of purchase. In general, usually these things are going to be pretty long, in the order of months, even potentially a year, but it will be on every package as far as what that expiration date is.
Was it a relief when they finally made Narcan so readily available?
Yes.
And have you seen a change?
Yes, we distribute a lot of Narcan, which is wonderful.
Yeah. And definitely, I think we've even seen statistics from the county, even just with the police distributing this and having it available. I definitely think there were some tangible results with that. So I think it's an important part of the process and the tools to combat this.
Someone's asking now too, how do you determine which program or which direction is best for you?
And I feel like I'm beating the drum here with the assessment that, right. Yeah, if you would need an assessment, and the assessment really looks at what level of addiction you have, what substance, and then they will direct you to saying like this would be the best level of care, or this would be our recommendation.
And individual for each person, where yes. they're at that moment in time, and that can change at a later period of time as well.
Yes.
And I know we did talk in the special too about you can go to the emergency room, and if you are ready and willing, they can put you in the right direction and start, you know, the journey to healing, I suppose. But we are being asked again too, what are some of the services available? Like what is out there in terms of Erie County for people? I know they can call you to do an assessment, but are there inpatient programs? Are they outpatient programs? How does that work in Erie?
Yes, we are. One of the beautiful things about Erie is we are a service-rich community. So there's outpatient, Pyramid, Cadenzia, Stairways, Safe Harbor, and then you would go up to the levels of care. So then there would be IOP programs that a variety of providers have in Erie. So it goes up that way.
Mm-hmm. What should you not do when approaching someone who you're concerned about?
Don't ignore it. I think it's important to have those conversations. They're hard, they're tough, but they're important to have.
Don't pretend like it's not happening.
Exactly. And denial can be a big issue. So it's important to have those conversations.
Right. It can be an easy way for you to deal with the problem, but it could, end up in death in this case.
Absolutely.
Also, why is it important to call this a disease rather than an addiction?
And I think it goes back to what we had mentioned earlier. Some individuals will feel this is a personal failure, or family members may have that impression, and really try to remind them that, again, this is part of the disease process. As some individuals, just one exposure to one agent and they can already be addicted, and others may not have that. There's just so much out there that we don't know around that. But yes, this theme of it being a disease process, not an individual failure, is really an important theme to stress.
And again, too, we're talking about it tonight. We had the hour-long special on earlier on JET TV on, I believe it airs Friday morning at 11 a.m. on our Fox station, Fox 66, if you didn't get a chance to see it then. Just us talking about it, though, is really, I think, a big step. Like spending this much time addressing this problem so people do understand, it's not just them. Because a lot of times when it comes to addiction or a disease like this, you feel like I'm all alone. No one else is going through this, and you feel alone and you don't feel like there's anyone you can talk to, but clearly we've learned tonight you can talk to anybody about this, and they'll put you in the right direction toward help.
Absolutely.
Not only can you, it's important too.
So if someone's watching, and as we wrap this up tonight too, what is one thing that you hope someone watching tonight who is like, wants to call that number, but they, because obviously it's that hard making that first call, or that first step's got to be the hardest thing, or admitting that they know someone who's having the problem. What's your advice to that person?
I think it's to recognize that there can be success, and there is success that occurs. It's starting that journey, making that phone call, making sure that there's an appointment with some resource. It's going to be important to start that process. We've got to start the journey, if you will.
And if it's not making the call, talk to your doctor.
Absolutely.
I mean, it's not like you all haven't seen this.
Right. And yes, trying to normalize how frequent, how common this is.
And sadly it is.
There's no family that hasn't been touched with this to some degree, unfortunately.
And so Jeanette, again, if you can give us the phone number one more time, and what would you say to someone who's like writing the number down, thinking about calling, they're afraid to, obviously don't be embarrassed.
That's what I was going to say.
You wouldn't
the
exist.
message I would have would be to have hope, and there's no shame. You should feel no shame. It's a disease.
It's a disease, and there's help. So if you do have the number again.
Sure, it's 814-451-6877.
And you all don't only deal with opioid. Obviously, there's a wide range of other areas where if someone's watching and maybe this isn't the problem they have, what else do you all do to help?
Any substance use disorder and gambling.
And gambling too. Because sometimes too, I know it seems like opioids, it's not so much, when you say, oh, the gateway drug, it started as this, it seems like people are just going to this.
It can occur.
And
absolutely.
that's what you were saying, where it just takes that little.
Yes, and these things are there's so much in the community that's out there and laced with substances, and there's always another new substance that's around the corner, unfortunately.
So basically what I'm taking from this conversation we've had, get the fentanyl testing strips. If you have kids, don't be naive. Just say, hey, listen, even if they're not for you, use them for your friends. However, get these in the hands of adolescents who maybe are out there being adolescents, because it happens. But this could save their life.
Yes.
Because like you said, they're not intentionally
Right. They just
headed
aren't
down
even
that
aware
road.
that it may be in there. And again, this fentanyl is in everything. It's just that widespread.
It really is. So the testing strips could be a lifesaver.
Yes.
They are free.
Yes.
Just go again, the
Yes.
address again on West 11th.
240 West 11.
I remembered West 11th, not 240. So 240 West 11, the Erie County Drug and Alcohol Abuse. Is that the right name?
Erie County Office of Drug and Alcohol
forgot that
Abuse.
one. But no, an important first step to do, you can call there, or again, talk to your doctor.
Absolutely. All can assist in getting you pointed in the right direction.
Now, do you all have the fentanyl testing strips too, or?
We don't have it in our office. I know
Okay.
we would use this department here to make sure.
So is that
a
what you would
community
do then,
resource-
is to direct
Absolutely.
someone?
And I
Okay.
know that's what we do so often, is trying to make sure we're networking with different community resources for whatever the patient's need may be. Obviously, in this instance, more appropriate for fentanyl test strips.
Well, and that's something too I think I've learned from all of this, is the fact that it is so collaborative. And it shows how important that is.
Team-based approach, no doubt about it. When I think of addressing this in the hospital setting, it's never just one individual. It's, again, social worker, behavioral health, pharmacist, physicians, just so many individuals that are involved with this. And it really touches every aspect of the healthcare system, unfortunately.
Unfortunately. Well, thank you so much. I've learned so much, and I hope people joining us too tonight on Facebook Live have learned something too. And I think the one thing we have to make sure everyone knows, don't be embarrassed. Get help. It is out there in abundance. There is no reason not to reach out and keep trying. Don't give up.
Absolutely.
Okay, can we agree? That's a good message. If anyone gets anything out of this, just reach out for help. It is there, and it could save you or your loved one's life. So thank you so much.
Thank you.
And thank
very
you all
much.
for joining us so much too.